Smoke from the California wildfires traveling hundreds of miles and air quality dipping into ranges deemed very unhealthy for people still in L.A. So what are the health concerns? Dr. Marc Siegel joins us now. Dr. Siegel, thank you for joining us this morning. So, obviously, everybody thinks about wearing masks and, covering your face. What are the most important things in addition to that people can do that are around the wildfires?
Well, Charlie, good morning. The first thing is we have to separate out what's acute and what's long-term risk. And one of the things that really is disturbing about this particular fire is it's in the city. So you're seeing a lot more toxins than you would if it was in wooded areas. And you have those particulate matter that's very, very small and gets deep into your lungs. So I'm particularly worried about children who have smaller lungs. And I'm particularly worried about people with underlying lung conditions and heart conditions where inflammation is caused that can provoke lung attacks, asthma, emphysema, heart attacks. All of that starts to fill the ER. And we're starting to see an uptick of asthma right now and attacks. Just as importantly is the mental health aspects of suddenly being displaced from your home, not knowing if you can go back. Our reporters have been reporting on people trying to get back to their homes, and they're told it's not safe yet, it's not safe. And these fires are still burning completely out of control. Smoke is the #1 health risk, not the fire, and the psychological reaction to that is huge.
But I think that's a really interesting and very important point to make, because obviously that's the reality on the ground there. Stress really has to be a huge factor in all of this.
Because you don't know where you're going to sleep that night, because you don't remember if you took everything that you need. You don't know if your home's still there. You don't know if it could be there now but not be there in 2 days. And all of these effects are long-term. If people with pre-existing mental health issues, the studies have been very dramatic on this. A study out of Alberta showed that 1/3 of all people in an area with a wildfire had long-term mental health issues. California studies over a decade looking at millions of people have shown this again and again. Remember that fire in 2020 burned over 4 million acres. And this one here is just getting started. Smoke, short-term health risks, the particulate matter, long-term health risks in terms of your lungs, risks of cancer, fertility issues, and again, worsening lung and heart problems.
So, and then obviously you see a lot of people wearing goggles because of the embers that are flying around. How important is it to keep your skin covered?
Well, that's hugely important, and I think in this instance, it's a time when we should really be promoting the use of N95 masks if you're close to the area. It was 65 degrees in L.A. County yesterday. I think air conditioning should be on. I think you should be in stores as much as possible. If you can get those air filters, they work. Yeah. There's a run on them right now. It's hard to get them, but the air filters work. The masks work, and getting as far away from the fire, obviously. Yeah. And another thing, most importantly, Charlie, this is insidious. It spreads for miles beyond the initial area.
All right. Dr. Siegel, thank you for joining us this morning.
Great to see you, Charlie.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.